52,000 Americans have died from drug overdoses, making it the leading cause of death in America. And 2/3 of those are from prescription drugs. Here are some of the numbers associated with this epidemic. There needs to be stricter regulations and better monitoring tools for pain management with opioids. Prescription opioids are overprescribed and have led to this epidemic. This epidemic has become the largest drug crisis in America. It is estimated that prescription opioid abuse, dependence, and misuse has cost New Mexico $890 million in 2007. The federal government has recently started to crack down on pharmacists, doctors that overprescribe opioids and painkillers. Prescription opioids are primarily used for chronic pain management. Pain management, acute pain after surgery. Most common indication of opioid use is management of acute pain after surgery, injury, or trauma. Pain occurring as a result of injury or trauma, except in the case of a head injury where opioids are prescribed and or used with caution. Cancer pain. Pain management associated with cancer. In advanced end stages of cancer, pain is difficult to manage. Opioids are generally used to manage terminal cancer pain. Pain arising from disease. Pain management associated with severe chronic and disabling diseases such as degenerative conditions and progressive diseases. Cough suppression. Many conditions cause a cough. These conditions may either be chronic or acute. Most often, providers will prescribe a medication to promote the secretion of mucus with an opioid, such as codeine. The side effect of opioid is cough suppression. However, opioids also have the potential to suppress the respiratory drive, especially in patients with already weakened respiratory drives, such as chronic obstructive pulmonary disease, COPD, or emphysema, a more severe form of COPD. Diarrhea suppression. Irritable bowel syndrome, IBS, and colitis are both conditions that are chronic in nature and cause frequent diarrhea. Opioids are not the first line of medication for management of diarrhea, but they are a viable option. Common side effects of opioid is constipation. Opioids cause delayed gastric emptying, thus slowing and managing diarrhea. Opioids have many benefits, but they are often misused. Recently, too many people have experienced the harmful effects of these medications. In response, the U.S. Food and Drug Administration, the FDA, has developed a comprehensive plan to take concrete steps towards reducing the impact of opioid misuse and abuse. The crisis. In the state of New Mexico, Espanola, or Rio Arriba County, had the highest total drug overdose rate of over 85 per 100,000 among New Mexico counties during 2011 and 2015. Albuquerque, or Bernalillo County, had the largest number of drug overdoses. Many New Mexico counties have total drug death rates more than twice the U.S. rate. Access to prescription medications is easy as an office visit to a primary care provider. In 2010, almost 1 in 20 adolescent adults, 12 million people, used prescription pain medication when it was not prescribed for them or only for the feeling that it caused. While many believe these drugs are not dangerous because a doctor prescribes them, often leads to dependency. Young adults, ages 18 to 25, are the biggest abusers of prescription opioid pain relievers, ADHD stimulants, and anti-anxiety drugs. They do it for many different reasons: to get high, to numb certain feelings, or think the stimulants help them study better. In 2014, more than 1,700 young adults died from prescription drug overdoses. Here are some of the motivations. How did it all get started, and how do we fix the problem? In 1999, the Veterans Health Administration launched Pain is the Fifth Vital Sign initiative, urging doctors to assess pain at every visit. Soon, other major healthcare accreditations and regulatory authorities, such as Joint Commission and Accreditation of Healthcare Organizations, joined the movement to improve pain management. To combat this systemic quality problem, healthcare providers need a systemic solution. One insurance company began to develop a solution after doctors reported that opioids were presenting safety issues. Misinformation about the use of opioids for chronic, non-cancer pain was a key driver of widespread overuse and abuse in the U.S. Focusing alternatives to opioid therapy as first-line therapy for chronic, non-cancer pain. Encouraging prescribers to utilize non-opioid options as first-line therapy. Using opioid options as an added option in management of treatment pain rather than sole management. Treating patients with the lowest dose of opioid possible for the shortest duration of time. Monitoring patients at risk for opioid abuse via questionnaires, drug screening, and prescription history on state prescription monitoring databases. Education. Identifying a high-risk opioid misuse and abuse is crucial to using opioid safely. Pharmacists play two important roles. First, they identify abusive drug-seeking behaviors in patients. These include requesting refills before they are due, submitting multiple requests for more medications, and having multiple prescribers or going to multiple pharmacy locations. Second, pharmacists monitor physicians who may be at risk of high prescribing. Opioids have many benefits, but they are often misused. Recently, too many people have experienced the harmful effects of these medications. In response, the U.S. Food and Drug Administration, the FDA, has developed a comprehensive plan to take concrete steps towards reducing the impact of opioid misuse and abuse. Opioid overdose, misuse, and dependence has become a nationwide epidemic. Opioids are usually overprescribed or overused. The benefits associated with opioid use, when prescribed at the lowest dose and the shortest duration, utilize other non-opioid options for additional pain management. Nationwide education will assist reducing the significance of this epidemic. Routine monitoring of patients on chronic opioid therapy is a must in reducing the potential of misuse. Here are some of the numbers and the consequences and the rise of the epidemic. A tremendous need also exists for public awareness about pain and pain management. Communities need to come together to agree upon safe prescribing practices. Many of the state medical boards have also updated their pain management guidelines to incorporate the most current information of opioid use. Eventually, consistency in treatment guidelines across all types of care will allow for safer use of opioids. Nearly every state has established prescription drug monitoring programs to track medication refills, prescribing patterns across all prescribers and pharmacies. State and health care organizations should continue their efforts to make databases easier to access, such as integrating them into electronic health records and making data available among all states.